Okay, it's November the 3rd, and tomorrow the UK is set to vandalise its society based on bad science. So let's take a closer look at this press conference and the data that they were presenting. Let's critique, shall we say.
Data from the ONS, the Office for National Statistics, shows that the prevalence of this disease has been going up extremely rapidly over the last few weeks, having been very flat due to the work of everybody in the country over spring and summer.
Nope, it's not the efforts during the summer, it's seasonality. So here we can see many studies, this one was very good, and we can see that coronaviruses in light green, right, rise from September, October in prevalence through the winter. This is seasonality. Coronavirus are sharply seasonal, and SARS-CoV-2 is too, like influenzas. So the reason it's rising now is seasonality, not low in the summer because of efforts. Right? It was low in the summer because that's how coronaviruses operate. We can also see it in the Gompertz curves. Right? So we had an epidemic. The epidemic ended because of the passing of the susceptible and community immunity developing in a now non-naive population, and we have the season coming in which polishes it off. Coronaviruses go right down due to human immunity levels and other factors. So we have a long summer with nothing happening, and now we'll have an endemic phase in the coming winter where the coronaviruses will rise, but the all-cause mortality impacts will not be epidemic levels anymore. So viruses get one big shot when they're new, and then there's never a scenario where they get another big shot in the following winter because things are completely different now. Interestingly though, the WHO came out on July 28th and denied seasonality when it was blindingly obvious that it was seasonal. So you've got to ask yourself, what drives these guys? It might be similar drivers as to what drives the two guys you're seeing on the screen currently. The Cornwall case-demic illustrates it beautifully. So, as we came into the spring and summer, British people couldn't travel, so they packed into Cornwall, a couple of million people, and jammed it out. We also had in Soho, everyone going around piling together with no masks, right? But what happened in Cornwall and Devon and elsewhere where this massive influx of people came in, even before there were masks? And it was also in other areas too. ICU spike over the 3 months where the people were piled in? No. Deaths over the 3 months where the people were piled in and the population nearly doubled in Cornwall, and Dorset and Devon? 0. That's seasonality, not people's efforts. So why are they doing this and why are they saying this? Well, you got to ask that question. So let's get back to the show.
Thanks to the work that everyone is still doing, the R is substantially lower than it would have been if people were not doing the social distancing, were not doing all the things in families, in firms, around the country. It would be going up much more rapidly than it is at the moment.
Nope. As I explained, seasonality. It's not the efforts during the summer. During the summer, coronaviruses pretty much fade away. And also during the summer, you had the benefit of the passing of the susceptible, sadly, had happened, and you have community immunity as built, right? And of course, you have the seasonality. That's what drove it. Also, you might observe that Sweden is getting a rise, but it's way lower than you guys who are locking down like lunatics over the last 6 weeks. Sweden is not locked down, and it's getting its normal winter rise, but again, with no notable excess mortality. And that's the difference when a virus has gone through its epidemic phase and is now an endemic winter virus.
But there is an increase in virtually every part of the country, and that is important because it is now at quite a high level, so things are going up across the whole country.
Okay, so it's rising everywhere. Well, we saw in the Mirror today, quite a good analysis, but you'll see that in London and elsewhere it's pretty much flattening off already before the crazy anti-scientific lockdowns. So it's not rising all over the place exponentially. at all.
There is a rise in virtually every age group in older adults, basically anyone over the age of 45. There's a rise in number of people going into hospital with COVID over time. And this is obviously going up not in a straight line, but in an accelerating line.
Not in a straight line, but an accelerating line. Well, that's normal. We've got an endemic virus now, SARS-CoV-2. That's the primary virus. The influenzas have faded out of the picture completely. We're not seeing excessive mortality or excessive respiratory mortality overall, right? And just to look at Ireland, 17-18, we see from September onwards, the rate of hospitalisation goes up through the roof, right through to the end of December, and then fades off. This is normal. Endemic viruses doing their thing. Sadly, it puts pressure on the hospitals. But there's nothing unusual happening here now, and you must look at excess mortality to judge if a season is unusual or would require unusual interventions.
But it is increasing in every area, and if we do nothing, the inevitable result is that these numbers will go up and they will eventually exceed the peak that we saw in spring of this year.
Okay, here we go again. I just explained that one, so you should be listening.
And therefore, if you look at the NHS as a whole, inpatient beds, dark blue is August, light blue is September, and purple is October. You can see it was still falling in August.
Okay, this is tiresome. In the winter, after an epidemic has passed in the previous season, you generally always get a huge increase in respiratory virus-driven admissions to hospital. This is actually normal, and we never locked down for it before. You could only ever consider doing an extraordinary lockdown if people were dying at a very excessive rate that could possibly justify it. But so far, we're not seeing that in Euromomo or anywhere in the UK, excess mortality. It's just that your hospital system has never been properly maintained, and you spent 6 months of the summer where we knew there was going to be no problem with coronavirus or SARS-CoV-2, and you squandered that 6 months and did nothing to increase capacity for this now endemic virus this winter.
Looking at individual hospitals, NHS hospitals, these are the hospitals with more than 100 COVID inpatients in them. This number will increase over the next weeks. And in green are hospitals which have got below half of their previous peak. In orange is the point where they actually get to half the number of people in hospital they had at the COVID peak, and in red is where they exceed the number of hospital inpatients they had at the peak of the first wave of this. And as you can see, the progression is steady, and we now have several hospitals with more inpatients with COVID than we had during the peak in spring. Okay,
here we go again. Endemic virus in the winter will pressure hospitals from September onwards. But there is nothing untoward happening if you don't have very significant excess mortality coming from that. And so far, there is no indication of that. But you could take crazy actions like ruining your society and your country if the excessive mortality became manifest. But I would say that this winter in excess mortality is not going to be very notable at all, because the epidemic has passed and now we are endemic. This person made a very good point that actually is very misleading what's being said in the press conference. So the reality is maximum of 27% occupancy in the highest occupancy hospital for SARS-CoV-2 positive PCR, and the vast majority are under 10% occupancy with the positive PCR. And remember, that includes a huge amount of people who are in the hospital for other reasons but got tested a few times and managed to get a positive, right? So I'm going to show you now the rest of the hospitals on the next slide. And as we can see, the vast majority are at a few percent with a positive PCR, never mind driven by COVID. The Mail Online did a great piece yesterday, and they call out all of the disgraceful mistruths and untruths in that press conference. And this graph that is used that makes it look like there's almost epidemic level occupancy due to COVID comparable to back in April when the real epidemic occurred, they actually cherry-picked the 29 worst affected hospitals. But here's the full picture of all the hospitals, and they chose the worst affected. So it appears that fraud is being used to terrorize the nation and to cause in turn society destroying, economy destroying, cancer diagnosis and treatment delaying, etc., measures to be voted on in Parliament. This is quite shocking.
Patrick is now going to talk briefly about the projections forwards.
Because of this continued R above 1, the modelling group asked a number of academic groups to create scenarios as to what might happen on assumptions that R stays above 1 and goes between 1.3, 1.5 and possibly up over the course of the winter. And the next slide shows the early working from 2 weeks ago of some of those groups looking at deaths in England over the winter period. But what is clear from all of them, in terms of deaths over the winter, there's the potential for this to be twice as bad or more in terms of the first wave compared to the first wave.
Okay, so we finally get to mortality, the index of interest in anything that's being called epidemic or anything like it. So here I've reproduced the original epidemic, and I'm going to have to shrink it down, right down in scale, to allow room for the preposterous modelling that came out in the press conference. So here we are, and here's what they're showing. No virus effectively in history, including prior coronaviruses like SARS-1 or the swine flu or influenzas, no novel virus after it's passed its epidemic phase has ever mustered a serious hit in the following endemic winter. But all the modelers are saying it's going to buck every trend in scientific history. And we won't get into 1918. That was a completely different scenario I dealt with elsewhere. Here in the mirror, we expose who the guilty parties are, right? For what it's worth. Of course, Imperial's in there. They are hysteria merchants extraordinaire. These merchants of modelling madness predicted these kinds of curves for Sweden. And Sweden did no lockdown and got a classic Gompertz, normal epidemic for a new virus, an influenza-like or otherwise. And if we show here Sweden, this big spike back in the early 1900s, that was the Spanish flu 1918, a singular event, a once in a century. And corona for Sweden with no lockdown, right? This is the corona spike, hardly distinguishable from any other year's bad months, excess mortality. And in fact, Sweden, for the first 5 months of the year, has no excess mortality whatsoever, right? Here's Sweden, just after the epidemic midpoint, May the 6th, CNN, elderly women getting their hair cut. The only guidelines were the WHO traditional guidelines up to November 2019. Irish pandemic guidelines are the same. They all say no quarantine, no lockdowns. Wash hands, stay at home symptomatic, keep your distance, blah, blah, blah. That's what Sweden did. This was Sweden in the actual epidemic. Here's Sweden, September 25th, after the epidemic has passed. Completely normal, no masks, even packed into public transport. Here's some more pictures from September, October, right? Completely normal, okay, waiting for the endemic phase this winter. And here's Sweden's performance for mortality per million people right up to November the 1st. They beat the UK firmly, right, back in the actual epidemic, and wow, are they beating the UK in the endemic winter phase. The graph says it all. And we have many published papers which illustrate from the actual data that lockdown policies deliver nothing or almost nothing in terms of mortality impact. They may help the hospitals if you're massively overloaded, but they don't help with mortality. In fact, they may build it up for later. And the link there, you can retype and you can download both the lockdown doesn't really work for mortality and also a folder with the impacts of lockdown, which are shocking and frightening and just a terror to behold. Professor Carl Hennigan has called out in the last day or two after this press conference that they used old modelling forecasts from October 9th purposefully because October 28th was available from Cambridge and it's much, much lower for mortality. Well, of course it will be, because I've explained to you. Excess mortality in an endemic winter following an epidemic of a new virus never matches the original epidemic for myriad scientific reasons, proven for decades. I put together in May 2020 the evidence against hard lockdowns beating Sweden's traditional pandemic management model, WHO up to 2019. Right, that's what they followed pretty much. And the evidence is massively stacked against lockdown delivering more benefit. Okay, and in there we have many examples, and there's a lot more papers now. You don't have to be an Einstein to work this out. I know an accountant who worked it out because he noticed in the height of the epidemic that the supermarket workers were sustaining no infections or deaths in any way, shape or form. 4.3 million in the US, UK as well, pretty much, and Ireland. You can see this clipping here. The supermarket and grocery workers saw no signal, and they were not locked down. They were 8 to 10 hours a day with no masks, indoors with the great unwashed flowing in and out all around them. And they saw no signal, even though they were uber not locked down. So you only need some basic logic to work this out, guys. So start asking questions. Again, there's the link to download the actual published science, preprints and peer-reviewed on this. But all the analyses pretty much come to the same conclusion. I'll show you one more example. We've got Florida here, and the clever governor, after bringing in professors from Harvard and Professor Michael Levitt, Stanford, realized the lockdowns were damaging society almost irreparably and not giving a benefit. So what happened after he lifted all the restrictions, all the bans, the mask fines, and completely went back to effectively normal? Well, the lockdown lovers would say, obviously the deaths per million, right, which were there, the virus was present, no problem in society. Obviously the deaths after a couple of weeks would begin to go up. But that's not what happened. They actually did what the science would say, that with or without lockdown, the mortality is not really going to be affected. It's going to follow its natural curve. Again, you can download all the papers here and get with the science, unlike these two characters on stage today. I'll just show a wider perspective. Here's Euromomo, and this is all-cause mortality. We see that in the 18 respiratory season, 140,000 excess deaths. This is pretty normal. And we see in the season total this year, 185,000. And Corona hit hard because the prior season of 2020 up to March was incredibly low, and 19 was very low too. So sadly, a lot of susceptible people would have survived through, sadly, to be hit by this new virus. But once the epidemic's over, it's over. And this is right up to date, and there is no signal across all of Europe for excess mortality, effectively, right? But if we take 18 across as an example, by all means Europe is going to see excess mortality through the winter. And because SARS-CoV-2 is the dominant virus and we're PCR testing like crazy, we're going to badge a lot of these deaths in the respiratory season as COVID-19. And there'll be hysteria, I guess, but it ain't going to be any different than 2018, where there was no hysteria and we did not destroy our society. So keep that in mind. There could be 140,000, as I said, but it won't be any different than before, because the endemic phase never really matches the hit of the epidemic phase for a new virus. New virus gets one big shot, you know. Here's England. England got particularly hit, but like all the countries, it was 19 season was extremely soft, and even 18 here was pretty soft. So a lot of susceptible people, sadly. And also metabolic health in England is pretty dire. So big hit. You'll notice there's no all-cause mortality signal yet, and this is right up to just October 20th or so. So if we move across 18, you could see this in England. Substantial excessive mortality over the winter period, but it would be nothing unusual, right? Endemic phase, excess mortality in the winter. And again, I'll direct you to the papers on lockdown efficacy. Here's one more paper. I just like it because it shows the severity of lockdown here on the x-axis, and then the deaths per million, and around 50 countries. The link is there. No relationship between lockdown and deaths per million that are actually experienced. And I'll draw your attention to two new papers, one in the BMJ, one in preprint, and they both use advanced analysis to say that lockdowns may soften the effect on the hospital, but at the cost of more deaths overall, COVID deaths. So, if you include the next season and your lockdown did suppress, the next season will come back with a vengeance. But if you don't suppress too much and you treat this like in an evolutionary fashion, scientific fashion, you will get extra community immunity in the young, and the aged who are affected by this will have more protection in the next winter. So these two papers indicate, and I think it's coming to pass, if you look at Sweden and other countries, that lockdowns maximize the overall COVID-19 death over 18 months. They actually maximize it, right? And that's not including the enormous burden of suffering and death that come from lockdowns through economic, cancer diagnoses, depression, suicide, etc., etc., etc. You got to add that on top. So I'd say there's blood on a lot of lockdown hands right now. And what do I think personally or scientifically? I think the two characters that are talking and trying to ruin the UK, should probably be brought into court with proper data, and maybe serve a custodial sentence, because what's the punishment for destroying your country? I reckon it should be pretty tough. And just a reminder that I do need support to continue putting together all of this content, and at patreon.com/IVOR COMMINS, or for PayPal at tinyurl.com/IVOR COMMINS, where you can do a one-off or a monthly support. So I'd really appreciate that, guys, and keep me getting the science out there and countering perhaps the more biased corporate type science. Thank you.